There are now 5 cases of people in Utah who are infected with measles. Mary is sitting down with state epidemiologist Dr. Leisha Nolen now to discuss the disease and how we can protect ourselves.
Are we ready? Yep. Yeah, we are. Okay. We're over here, ready. We have Dr. Leisha Nolen here, again, the state epidemiologist. So we had 2 new cases added, so that's a total of 5.
Yeah.
Explain what these cases are. Who are these people?
Yeah, so we have 5 individuals across Utah who've had this infection. 2 of them live in southwest Utah and 3 live in Utah County.
Okay.
4 of them are adults, but there is 1 person who is a minor. What really concerns us is 2 of these people have been hospitalized.
Oh boy.
This is a bad infection, and it shows that we are getting that bad infection here in Utah, and so we are very concerned.
Okay, and 2 of the adults are pregnant.
Yes, that's right. 2 of the adults are pregnant. And what worries us most about that is women who are pregnant, when they get measles, they are much more likely to have severe infections, but they also can lose the baby. They can have a miscarriage because of the measles infection. So we really are encouraging people who are thinking about getting pregnant to protect themselves against measles by getting a vaccine.
Okay, and children, there's 1 child, a minor.
Yes.
Can you say how old or not?
No, at this time
I didn't know if you could or not. But how did they get the measles? Do you know the source yet?
Yeah, so 1 person we know did not travel outside of Utah, did not have anyone visit from outside of Utah, so it appears they got it from within Utah. So that means we do have cases here we probably aren't detecting, or we know we aren't detecting. The other 2, so there's 2 different clusters.
Mm-hmm.
Those were people who traveled some, so it might have gotten them from somewhere else.
And there's a chance that they could infect others now?
Yeah, so happily all these people have been working very closely with us and their local health departments. And they have been very agreeable to stay home, stay away from other people. They're really interested in protecting their community. So they have been doing the right thing about not going out, not exposing others.
And they don't want any family members to get it.
Exactly,
But
yes.
with measles, can't you be exposing someone before you have many of the symptoms?
Yeah, the early symptoms of measles are very generic. They seem like a lot of colds. The fever, runny nose, cough, red eyes. It sounds like every other cold we have, right? So people can go and expose other people before they realize they have it. In that case, with these specific people, we talked with them about who exactly they'd been around for those days, and we're able to contact those people and make sure they know they might have the exposure to measles.
Well, and they might just want to go to the doctor. And then could they infect people in the waiting room?
Yeah, so certainly we are encouraging people to call ahead before they go to their doctor, because we don't want a whole waiting room exposed. The worst case scenario would be if we had a little kid and we go in and have a lot of babies exposed who aren't protected yet, and that would be very bad.
And so if you have a cold that's getting worse, do you have to wait for the bumps?
I think if you know you've been exposed to measles or someone with measles, certainly if you start getting those symptoms right away, we would encourage you to call up your doctor, talk about what your symptoms are, see if they think it's likely measles, and work with that. Other people at this time, I mean, anytime we get colds, I'd encourage you not to expose other people.
Yeah, even just a cold.
Yeah,
don't expose other people.
I don't want your cold.
Right.
So we encourage people to stay home when they're sick, just like we have for forever.
You were here a few months ago when we were talking about the measles outbreak in Texas and in the different areas where that has spread. And you said it's only a matter of time.
Yeah.
Because somebody may have visited from Texas or wherever, and with more people unvaccinated, is that leading to some of the problems?
Certainly the decreasing rates of vaccines in younger kids is affecting this whole outbreak across the entire United States, if not the world. We know the vaccine's excellent, and people could stop this outbreak by having vaccine. There are certain communities where less people are vaccinated, and then those are the people who are super vulnerable to this outbreak.
Okay, and the vaccine is the MMR, measles, mumps, and rubella.
Correct.
That I think most kids get at what age? Elementary school?
Actually, when you're 1 year old, and then around 4 years old is when you get your first dose and then second dose.
And back in the day, I mean, I remember my mom trying to keep track of all the kids in vaccinations. You had to show up with your little card saying that you were vaccinated.
Right, yeah. So schools typically do, well, actually schools all do, take a record of if you've been vaccinated. They keep records of that. Here in Utah, we do have exemption rules, so that's how people are able to still go to school even without vaccine.
Well, and some people don't want their child vaccinated because of maybe an immune disease or something that might make them more vulnerable. But in cases like this, that child might be more exposed and more likely to
Yeah.
get something because of other people not being vaccinated.
It's true. So people who have significant immune conditions cannot get this vaccine.
Right.
But that should be a very, very small portion of our population. But they are depending on the rest of us to be vaccinated. So we protect them. We keep a shield around them in a way so that the vaccine or the virus doesn't get through us to them. And that's the same with little babies. Babies under 1 year of age, they can't be protected with the vaccine. So we are acting as a shield for them.
Okay, and Utah, how is Utah with vaccination rates, specifically for measles?
Yeah, so our vaccine, we know that more than 90% of our population is vaccinated. So most of us are vaccinated and we are protected, and that's really reassuring. But we know there are areas of Utah where there are less people vaccinated, that there has been a lot of hesitance to get these vaccines, and those are where we know there's going to be a risk when the virus gets introduced.
Oh, other than getting the vaccination, what can people do to protect themselves?
I mean, certainly vaccines are the most important. But other things is if there are people who are around who are sick, stay away from them. We have heard there are some rumors about communities where they see a lot of kids with these kind of symptoms. If you're in those communities, don't go around in those areas at that time.
Would wearing a mask help?
Certainly a mask can help.
I mean, if you're sick.
Yeah, if you're sick. And actually, if you're not sick too, this is an airborne virus. It's actually one of the most, it is the most infectious virus we know. You just have someone walk into a room with it. They can infect over 80% of the people in the room, and it stays in the air for 2 hours. So it is very infectious. So certainly a mask does help. You need one of the high quality masks, but I know that a lot of people don't want to go back there.
Yep, that's for sure.
Yep.
Okay, Dr. Nolen, thanks so much. Is there a resource website we can connect to? I think we have the information on our website.
Yes, certainly our
since we can.
Department of Health website, Department of Health and Human Services. Yep.
Right, we have a link. Go to KUTV.com and click on Check Your Health, and we have all of the information there.